Video we will be going to study about the therapeutic index, therapeutic window, what is AD50 or effective dose, or what is lethal dose, or what is toxic dose. So all these things will be covered in this video. Okay, so we are going to start with the therapeutic index. Actually, if you will go to the definition of the therapeutic index means dose that produces toxicity in 50% of the population. So I can write here dose that produces toxicity in 50% of the population upon dose that produces clinical effect in 50% of the population. So that we call it as therapeutic index. I can write TI here. TI is equal to therapeutic index. It's equal to dose that will produce toxicity in 50% of the population or 50% of the animals, and dose that produces clinical effect in 50% of the population or 50% of the animals. So why I am using animals here? Because during the preclinical studies, all the studies are done on the animals. So in case of the animals, this therapeutic index, it will be equal to LD50. For animals we use lethal dose upon ED50. LD is the lethal dose, ED is the effective dose, and for humans we will use therapeutic index is equal TD, toxic dose 50 upon ED50. So for humans we are using toxic dose, for animals we are using the lethal dose. Okay, so this means dose that produces toxicity in 50% of the population. At a particular dose, if the 50% of the animals die, for example, you have 6 animals. For example, at dose 1500 mg, if among these 6 animals 3 animals die, that means at that dose 15 mg is the toxic effect of that very drug. While dose which produces the clinical effect in 50% of the population, for example 500 mg is the dose. We have the 6 animals, and out of these 6, 3 produce the clinical effect at this dose. So this will be 500 mg will be the effective dose. Okay, so the dose that produces toxicity in the 50% of the population upon the dose which produces clinical effect in the 50% of the population, so that is called as the therapeutic index. So we will now explain this by using a graphical representation. So from one side we have the log concentration of drug in plasma. So this is log concentration of drug in plasma. On x-axis we have log concentration of drug in plasma, and on the y-axis we have the percentage of patients. So I am giving the example of the humans, so I have written here the percentage of the patients. Okay, so here it is 0, for example here it is 50, and here it is 100. So 50% of the patients and 100% of the patients. Okay, so when we will give the drug, for example it produces a sigmoid curve like this. Okay, and this here at the 50%, this will be this one. If I will interpolate this, it will be ED50. So effective dose 50. So at this dose of the drug, 50% of the population, it shows in 50% of the population it shows the effect. So that one is called as the ED50. Now for example, at a particular thing, for example here this is the second graph. At this, for example, at this point 50% of the population is showing, because we are increasing the dose, log concentration of drug in plasma. So when the log concentration of drug in plasma will increase, at some point of time it will show its toxic effect. Okay, it will show its toxic effect at some point of time, or toxic dose. So this here is the toxic dose, and this here I can write it as TD50. So this is the TD, this point is the TD50, and this is the ED50. Okay, so the distance between them, this distance, this is called as the therapeutic index. Okay, so the distance between the AD50 and TD50, that is called as the therapeutic index. I will again explain you. This is the log concentration of the drug in the plasma. When the concentration of drug in the plasma is 0, so it is here. When the log concentration of drug in the plasma keeps on increasing, so this here it will keep on increasing its effect. For example, it is showing the effect here, so that is AD50. And when the concentration of the drug increases at some point of time, so this concentration, it will be the toxic dose 50. So the distance between the AD50 and TD50, that is called as the therapeutic index. Or we can say that distance between the beneficial effect of dose response curve, because this is a DRC, dose response curve. So we can write it as the distance between beneficial effect of DRC and second one is unwanted effect of DRC. So this is the beneficial effect of the DRC. This one is the unwanted effect of the DRC. So the distance between them, that will be called as the therapeutic index. Or we can say that it gives us idea about the drug safety margin. So it is very important. Drug safety margin. How much the drug is safe. Okay, there are some drugs whose dose, if we will increase, they will produce the toxic effect, and there are some drugs whose dose we will increase some point of time, they will not produce any toxic effect, but at some level they will produce toxic effect. Okay, so that is called as the therapeutic index. Now, if the therapeutic index is higher, therapeutic index TI, so higher the therapeutic index, safer is the drug. If the therapeutic index, if the value of the therapeutic index is higher, that means that very drug is safe for the use. Okay, so higher the therapeutic index, greater is the safety of the drug. For example, I will give you the example here. I am taking the example. For example, first remember that LD50 by ED50. Okay, LD50 upon ED50. For example, the LD50 of the drug is I am giving the example, LD50 of the drug is, for example, 100. Okay, and ED50 of the drug, for example, is 10. So it will be 10:1. Okay, now I am taking the another example, means therapeutic index here is 10. I am taking the another example. For example, the drug has 20 is the LD50, and for example, again 10 mg is this ED50. So it will be 2:1. So it is 2:1, it's 10:1. Which one is safer? This drug is having the higher therapeutic index, so this is the safe drug. This one is having the lower therapeutic index, it's not that much safe as compared to the first one. So this is called as the therapeutic index. Okay, so safe drug must have a therapeutic index which must be greater than 1. Normally therapeutic index must be greater than the 1. So we consider that drug as safe whose therapeutic index is greater than 1 or it is equal to 1. Okay, if it is less than 1, the drug is not considered safe. For example, I will give the example of the drug. Examples of the drugs who have the high and low therapeutic index. So I give the example of the drugs who are having the high therapeutic index. Example is, for example, penicillin, diazepam, atenolol, which is an antihypertensive drug. So these are the drugs which are having the high therapeutic index. Okay, now there are some drugs which are having the low therapeutic index, low TI. Examples of those drugs are, for example, lithium, warfarin, digoxin. So for example, if the effective dose of this digoxin is, for example, 500 mg, I am giving the example, it's not 500 mg. So if it is 500 mg, if I am increasing the dose of this drug, so it will produce the toxic effect because it is having a low therapeutic index. So here you can see the distance between 10 and 1. So there are 9 in between them. So you can increase the dose of this very drug, but here there is a very less margin, so you cannot increase the dose of drug to that much extent. So it is having a less margin, it is having a high margin. So the drugs who are having the high margin, they are much safer as compared to the drugs which are having the less margin. One more thing which is important here, therapeutic index, it may be different for each use of drug. For a single drug, therapeutic effect can be different. It depends upon the use of that very drug. For example, I have taken here the aspirin. I have taken the example of the aspirin here. Okay. So for aspirin, if you will use the aspirin for headache, then the therapeutic index will be different. If you use the aspirin for inflammation, because it is used for headache as well as inflammation, so if you will use this drug for headache, therapeutic index will be different. For inflammation, the therapeutic index of this drug will be different. So a same drug can have a different therapeutic indexes. So that is one more thing which you have to remember in this. Now there is a difference between the therapeutic index and the therapeutic window, which I will explain by this graph. For example, again I will draw the graph. So this is the efficacy, effectiveness of the drug. This one is the toxicity of the drug. Okay, and here I already explained you this point. This is called as the median effective dose, so we can call it as effective dose. And here this is called as the lethal dose or toxic dose. Okay, now from this point here to this point, this area, this whole area, okay, so I will color it in, for example, red. This whole area, this is called as the therapeutic index, TI, the distance between the effective dose and the lethal dose or toxic dose, that is called as the therapeutic index. So you can see here, this is the therapeutic index. Okay, now second one is the therapeutic window. So therapeutic window will be this one. So this was the efficacy. If I will draw it like this, so this area in white, this white area, this will be called as the therapeutic window. So therapeutic index, this one, and therapeutic window is this one. Okay, so here this one is minimum toxic dose, and this one is, sorry, this one is minimum effective dose, minimum toxic dose and minimum effective dose. Okay, so that is the difference between the two. Or I can explain you this by one more example. For example, again I will draw a graph for this to explain you this. Okay, so from this side on the x-axis, this is dose mg per kg, and I am taking some antipyretic drug. For example, antipyretic drug means which is used to treat the fever. Antipyretic drug, any of the antipyretic drug I am taking. For example, I am taking the paracetamol, example of the paracetamol, for example. Okay, and I will write here from this side its number of patients who are taking this drug. So the number of patients, for example, here it is 20, here it is 50, and here it is 100. These are the number of the patients. And dose mg per kg, I will write here the doses. For example, this dose is 200, for example it is 400, then it is 600, then for example 1500, then 1700, then 1800, and so on. Okay, it is the dose. Now when the dose is 200, when the dose of the drug is 200, how many patients are showing the effect? 20, for example. 20 of the patients are showing effect. Okay, so I will first draw the graph here. Okay, so when the dose of the drug is, for example, this, here it is 500, this here it is 50, at 50, so at the dose of 500, how many patients are showing the effect? 50 patients. So 50% of patients are the showing the effect. So this will be ED50. So at the dose of 500 mg, how many patients are showing the effective dose, means how many patients are showing the clinical effect? 50% patients are showing the clinical effect. So this point here is ED50, or we can say it as median effective dose. So this is the median effective dose where 50% of the people are showing the effect. Okay, now we keep on increasing the dose. For example, the dose goes up to this 1500. Okay, so we keep on increasing the dose. For example, the dose now reaches the 1500 dose mg per kg in the plasma. So if the dose of this antipyretic drug is now 1500, at some point of time, see here, if we will join these lines, this and this here, for example, this one is 1800. Consider this point is 1800. Okay, this point here is, it is 1800. So now at this point, at the dose of 1800, how many people are showing the lethal dose, lethal effect, or which is called as the toxic effect? 50% of the population is showing the toxic effect here. So this point will be called as LD50. So this is the LD50, this one is the ED50, this point here is LD50. So here how many patients at the dose of 1800? 50% of the patients have shown the toxic effect. So here the 50% of people have shown the toxic effect. So this dose here, this 1800, this will be the lethal dose, or this will be the toxic dose. And here this 500 mg, it will be the effective dose. So 500 mg for any of this, for example, any antipyretic drug, here the 500 mg is the effective dose and the 1800 mg is the toxic dose. Okay. Now, if we will calculate the therapeutic index for this drug, so therapeutic index for this drug is, what is LD50 here? Because therapeutic index is equal to LD50 upon ED50. So the LD50 lethal dose here is 1800. From this graph you can see lethal dose is 1800, and what is the effective dose? It is 500. So 1800 upon 500, how much it will come? 18 upon 5, it will be almost 3.6. So it is greater than 1, so the drug is safe. So this antipyretic drug is safe. It is having the therapeutic index of 3.6. So this is how you can calculate the therapeutic index of a drug. Okay, so from here you are having the number of patients, from this side, from the x-axis you are having dose per mg per kg. When you will keep on increasing the dose, a point will come when the drug will show its toxic effect. So the dose here was 1800, at which the drug was showing the toxic effect, means the 50% of the people were showing the toxic effect. So this is LD50. Okay, and here at the dose of 500 mg, 50% of the people were showing the effect, means they were showing the therapeutic effect. So that is effective dose. Okay, so ED50, LD50. So therapeutic index is equal to LD50 upon ED50, 1800 upon 500, which comes 3.6. Now if the drug here, in the same case, if the drug will be having the LD, for example 80, and this effective dose, for example 50, so then what will it come? It will come 8 upon 5, that is 1.6 almost. Okay, so this is toxic drug, this is the toxic therapeutic index for drug. So this drug is toxic, but this drug is safe. So this is how the therapeutic index plays an important role in the safety margin of the drugs. Okay, so therapeutic index, it is having very good importance in this. Now I will give you one more example. For example, the therapeutic index of drug is 5. TI of the drug is 5, and its effective dose ED, it's 9. Now you have to calculate here the toxic dose. So what is the toxic dose? Okay, so therapeutic index of drug is 5. So we have the formula, therapeutic index is equal to TD50 upon ED50. So what is the TD50 here? We have to calculate the TD50. So therapeutic index is 5. 5 is equal to TD upon ED50 is 9. So which means 9 into 5 is equal to therapeutic dose. So therapeutic dose will be equal to 45. So 45, it is a high therapeutic index drug. Okay. So this one is a high therapeutic index drug here. So this is the example how we can calculate the toxic doses, how we can calculate the lethal doses, how we can calculate the therapeutic index of any of the drug, because sometimes in computer examinations they ask these type of questions. Okay. So now if we will go further to understand this effect to doses and all, for example, from one side on x-axis and y-axis. So this one is x-axis here, okay, where we see the plasma drug concentration. This, for example, no, we are taking the plasma drug concentration right now from here. For example, this is plasma drug concentration. So there are different things here. I will draw a line here, 2 lines. So if a drug falls in this range, this range is called as subtherapeutic range. Subtherapeutic range. So drug in this range will not show any therapeutic effect. That's why it's called as the subtherapeutic range. For example, you are giving the 20 mg of the drug. Okay. So 20 mg of the drug, so it will not show any effect in this range. So this is called as the subtherapeutic range. So when drug reaches this concentration, the line which I have drawn here, it's called as desired response threshold. So here this is desired response. The response will come from this point. Okay. Further, if we will keep on increasing the dose of the drug, a point will come. So this point here, this line here, this is called as adverse response. So here the drug will start showing its adverse reactions threshold. This is also the threshold. Further, if you will increase the dose of the drug, then it will show its toxic effect. So here it will be toxic effect of the drug. Okay. So what we are having, subtherapeutic range, then we are having the desired response. So this in between this adverse response threshold and desired response threshold, there is this range. This range is called as the therapeutic window or therapeutic range. Therapeutic window, or we call it as therapeutic range. Okay, this whole area. And further, if we will increase the dose of the drug, then the drug will go into this will be called as the lethal dose of the drug. So these are the different terms which we will use for any of the drugs. So here it is plasma drug concentration. Okay, so this is subtherapeutic dose, subtherapeutic range. In this range, drug will not show any effect. The drug will show effect at this point. This is called as the desired response. Further, you increase the dose, it will reach here, it will show the adverse effects, then it will show the toxic effects. Further increasing the dose, so here it will be the lethal dose of the drug. Now the same thing can be explained by other graphs as well. Okay, so one more thing which is important here. So for example, on this side it's time in hours. Okay, and from this side it is plasma drug concentration. Plasma drug concentration means concentration of the drug in the plasma in mgs, milligrams. Okay, so here it is time in the hours. So for example, at 0 we have taken the drug, and I am making one graph here. So the drug will show effect like this, for example, and then a point will come when it will be eliminated, and it will be like this. Okay, so here I already told you, for example, plasma drug concentration, for example, of the drug, it will here show its effect. So this will be one thing. Second, like this, which I already explained previously. Okay, so here this is the onset of the action. So drug will start showing its action here. This is the onset of action of drug. Okay, so this is the onset of action. I can interpolate it here as well. So this point is the onset of action. Okay, and what is this area? It is subtherapeutic area or subtherapeutic effect. So till this concentration drug will not show any effect. So drug is showing effect at this point. This is called as the onset of action. Then there will be absorption. So this will be absorption area. Okay, so it will reach a maximum point here, which is called as the Cmax. So concentration of the drug here is maximum concentration of drug in body, or which is called as the peak level, Cmax, or we call it as peak level. So peak level of the drug. Okay, this is the peak level of the drug. So at this point, rate of absorption will be equal to the rate of elimination. So rate of absorption is equal to rate of elimination. At what point? Cmax. Okay, so rate of absorption, it will be equal to the rate of elimination here. Okay, then after some period of time, the drug will start declining in our body. So this point will be reached. So this point is called as here it will be termination of action. So this was the onset of action. This is the termination of the action. Okay, so between the onset of action and the termination of action, we can call it as, this is the duration of action of drug. Duration of action of drug. For example, this was 1 hour, for example, and for example here, this point, it was, for example, 3 hours. So 1 and 3, so duration of action will be 2 hours. Okay, for this drug, you can calculate the duration of action. So this area is called as the area under curve. This whole area will be called as the area under curve. And this one is subtherapeutic level, because when the drug action will be terminated, then it will go into the metabolism phase. So here there will be a drug will be eliminated from the body here. Drug elimination from the body. So this was termination of action. Okay, onset of action, termination of action. Now this point here, what is this point called as? Because drug is showing the toxic effect, already explained. Drug is showing the toxic effect here. So this I have already explained. Okay, so this point here is called as the minimum safe concentration, or we can say it MSC. So this is the minimum safe concentration. If you will go above this minimum safe concentration, drug will start showing its toxic effect. Okay, and this point is called as MEC, means minimum effective concentration. Okay, so the drug will start showing its effect from this point. So this is called as the minimum effective concentration. So minimum safe concentration means up to this point the drug in the body is safe. If the concentration will go above the minimum safe concentration, drug will start showing its toxic effect. Okay, and minimum effective concentration means the drug will start showing the effect here. If the concentration of the drug is below minimum effective concentration, it will not show any of the therapeutic effect. That's why this area is called as the subtherapeutic range, or that effect is called as the subtherapeutic effect. So this is very important. Okay, and now between these two, minimum safe concentration and minimum effective concentration, this whole is called as the therapeutic effect. Therapeutic effect. So already I have explained you therapeutic index, and this one is the therapeutic effect of the drug. So the distance between the minimum safe concentration and the minimum effective concentration of the drug, this distance, this is called as the therapeutic effect of the drug. So above this minimum safe concentration, the drug will start showing the toxic effect. It means if you are increasing the dose beyond this minimum safe concentration, drug will start showing its toxic effect. And if the concentration of the drug is very low in the body, it will show, for example, if the paracetamol is showing its effect at 100 mg. Okay, so if you are giving 20 mg of the paracetamol or 70 mg of the paracetamol, for example, it will not show any effect. So that will be called as the subtherapeutic dose. So the subtherapeutic dose, for example, for the paracetamol is 20 mg. For example, it is showing now effect at 30 mg. So 30 mg will be the minimum effective concentration. So at that point, the drug starts showing its effect, and it shows its effect. It reaches a point which is called as minimum safe concentration. If it will cross this minimum safe concentration, then drug is not safe for us. It will show the toxic effect. Okay, so these are the things which we have to understand in this thing. So to sum up this thing, we can say that for a drug to be effective, the graph must be above the minimum effective concentration, okay, and when the graph goes above the minimum safe concentration, okay, then it shows the toxic or adverse reactions, okay, and then subtherapeutic level or subtherapeutic effect. Subtherapeutic level, it has no effect on the body, and the distance between the MSC and MEC, that is called as the therapeutic effect, which is very important. So the points which we have learned here is minimum effective concentration, minimum safe concentration, subtherapeutic effect, therapeutic effect, okay, toxic effect, okay, lethal dose, it will go above this at Cmax. Okay, at Cmax what will happen? Rate of absorption will be equal to rate of elimination. So these are the points, these are all points which we have covered here: therapeutic index, therapeutic window, therapeutic effect. So all these points have been covered in this. Thank you. We'll meet in the next video.